Türk Tabipleri
Good
Birliği'nin
evening to everybody.
birinci yılı çerçevesinde düzenlediği bu
The Turkish Medical Association is organizing this conference, the first year of pandemic in Turkey. Now it is the second session of tonight. We talked about the discrimination that has been deepening during the pandemic before the session. And in the session, actually, during the first year of the pandemic, which has had a great impact all over the world, from health to economy, on the social life. And this conference is very valuable in terms of discussing it. I would like to thank all my colleagues. In our session, we'll be talking about the impact of the pandemic on work life. We have three distinguished speakers. First speaker is Meryem Betül and our second speaker is sociologist Aslı Odman, our comrade. And the third speaker is from far away, but she has always been with us, in solidarity with us. And several years ago, we had hosted her in an activity. She's a sociologist, but she has many other features as well. She can introduce herself later. Ani Tebo Moni. Before the activity, we'd like to hold a small commemoration today for all those persons who've been struggling for their right to health, not only the health workers, but all those fighting for equality, freedom, justice. We will commemorate Ata Soyer. He's been a comrade for all those persons who've been struggling for these causes. It has been 8 years since he left us. We would like to commemorate him with love, respect, and longing. He actually had a role in the struggle for all of us who made this conference possible today too. He had great contributions. So now, in order to commemorate him, we'll be seeing a small video clip of 2 minutes, and then we will start with our session. Interpreter note, I will try to summarize the speeches. He's the head of the Ata Soyer Research Center for Health Policies, which was established in 2014. He touched all of us. Ata had taught me that health has to do with the social and the political, that nothing is coincidental. There's pandemic, economic crisis, vulnerabilities, and lack of stability, and we need Ata. We learned many things from you, and we're carrying it in our hearts, what we learned from you. You were dedicated to universal values, and that's what you taught to us. He was an organizing person, and he showed us the way. Referring to memories with Ata Soyer 9 years ago. There's 3 important things about him, I could say. First is he was a man of thinking and action. Second, he was always unifying us in all fields. And third, he unified the union struggle with the struggle of professional chambers. We have been shoulder to shoulder in the same struggle, and I'm honored by that. I am commemorating him with love, respect, and longing. We miss him so much. We won't forget you.
Evet, Doktor Ata Soyer'i, sevgili Ata abimizi bir kez daha
Yes,
saygıyla
we commemorate our brother Ata Soyer with love and respect once again. Now
konuşmalarına başlayabiliriz.
we can start with the
Konuşmacımız
presentations, the speeches of the panel.
sürecinde örgütlenme deneyimleri,
The first speaker will be talking about the experiences of organizing of workers, employees,
somut gerçeklikler,
the concrete problems.
COVID-19 pandemisi
During the COVID-19 pandemic, as you know, there has been a social and health crisis. But as we had all
ekonomik ve toplumsal bir
foreseen, there has been a massive social destruction, unfortunately, and Turkey especially has been suffering from the socio-economic destruction in the most severe way. There are two reasons for the first.
olağan bir süreçte
We
yakalamadık. Zaten çok
were not in pandemic. We had already been in an economic recession.
içerisindeyken
We had been involved in a crisis already.
ikincisi de
And the second is that the Justice and Development Party government, just like in other periods, have actually violated the rights of the workers, employees, the retired citizens, people who lost their lives. They actually try to protect the capital instead of people. So these were the kind of policies. So these are the two main reasons why we suffered, especially from the COVID-19 pandemic and its impact in many fields. Another important issue is actually emphasized in the first session. Actually, COVID-19 showed us many things, but one of the most important things that it revealed was that the worker class was invisible, but that it was actually unveiled now. Without workers, without work, without labor, nothing can happen. Life cannot be sustained. So this was really revealed. It was unveiled. And throughout this process, the government's policies were all directed to letting COVID-19 become a workers' illness because workers were left outside of all restrictions. And there's another thing that COVID-19 pandemic actually revealed is that the existing system, whatever we name it, capitalism, neoliberal capitalism, whatsoever, the existing system has actually violated the rights of the working class, the laboring class. It has shown the inequalities, and it has shown that it can offer nothing to the working class throughout the world as well as Turkey. So now that we're going to be talking about the work life, it is important to discuss it for the future of the working class. And the first speaker is going to talk about the organization dimension of it concerning all the losses of rights from a concrete field of labor and struggle, from the solidarity of cafe workers. Betül Topkaya. So I'm talking on behalf of the solidarity of cafe and bar workers. I would like to thank the Turkish Medical Association for giving us a floor. First of all, the solidarity for cafe and bar workers. How was it established? And what do we need? I can talk about these first. We are workers in cafes and bars. Flexibility and precariousness was our main problem, and we were trying to find ways to struggle. And during the pandemic, we have seen the flexibility and precariousness and how destructive they are. We felt it in ourselves. The poverty has come to a level and has come to such a level that there was no other remedy but to get together, come together, and organize together. Let me talk about some of the features of the sector and the conditions under which we're trying to organize together. It will give you an idea about these. The most important determinant of the sector is that both the workers and the bosses see the work as temporary. This temporariness is obstructing us from long-term struggle. It has become a reason for not being able to struggle for long term. And of course, during the pandemic, there was no other way but to organize together. I think the pandemic has shown us this. And due to this temporariness, there were some of the conditions that we encountered. First of which is there needs to be a union struggle, which is long term, but there's this struggle that is missing. And because the struggle is missing, there's precariousness. And most of our friends are suffering from income losses. And which shows these problems show that the Turkish workers' problems are reflected generally. We, as the solidarity of cafe and bar workers, would say that we were involved in a struggle during which especially young workers has this energy, and young workers try to evolve this into an organized working movement. And actually it was the state that totally made them invisible, because this was temporary work, this was not a very valuable work per se, because throughout the pandemic many people were working without security insurance and they could not benefit from temporary unemployed funds. And these people had to work in other works now because they were unemployed, and they actually risked their health, and they could not actually employ the measures recommended by the Ministry of Health. There were those student friends, for instance, who could not find work at all. They had to go back to their family homes, which was a whole lack of self-sufficiency feeling, which was much more difficult, especially for women, because in workplaces, despite mobbing and exploitation and harassment, women were still working in workplace and they were being independent of the family and the authorities, but then they were severed from this work, which was further destructive. And this created a whole anger. And at this very point, this solidarity was against the violation of against our labor, and this made us organize together. And this association, this solidarity for cafe and bar workers, actually try to find solutions to the common problems. And we try to unify, make common our demands. The impact that the solidarity created is actually owing it to the mechanisms of the pandemic, as well as the effect of the past experience on the streets. So we said we will make a social media campaign. Of course, we prepared the social campaign. We started with opening the doors, and we continued with our silent activities in 3 different districts in Istanbul, which created a public opinion concerning our sector. And we created a branch in the tourism union, and we tried to find a way to make a collective agreement. Through YouTube, we tried to disseminate the information live. Actually, cafe bar workers can act very rapidly due to the young population employed, and we try to open channels in all fields. So actually our colleagues, our friends, their friends, they all came together, and actually we try to use the social media in the best way possible to organize in the most effective manner. WhatsApp, Telegram groups, as well as there was another social media group in which all people who want to contribute to our struggle can join. And we try to actually showed that the funds did not work for us. The Justice and Development Party's policies were revealed actually here. And in one of our past activities in Istanbul, Ankara, Izmir, Kayseri provinces, and Samsun and Bursa provinces, in 7 provinces, we had held simultaneous activities.
Sesim geliyor mu?
Can you hear me?
Tamam. Mart ayıyla birlikte bizim mekanlarımız açıldı. Mekanların açılmasıyla beraber de birçok çalışan işine dönememişken kısa çalışma ödeneklerimiz kesildi. Zaten normalleşme sürecinde kafeler işçilerinin düşük ücretlerle, sigortasız bir şekilde ve uzun saatler boyunca çalışmaya zorlanacağını biz öngörebiliyorduk. Bu noktalarda da yeni mücadele yordamları geliştirmeye çalışıyoruz. Hazırlıklarını yaptığımız noktalar da var. Onlar da şunlar. Kafe sektörü çalışanları için bahşiş önemli bir gelir kaynağı. İşverenler de zaten bu gerçeğin farkında olarak daha düşük ücretlerle işçi çalıştırabiliyorlar. Yani işçi 120 lira günlük gelir hedefliyorsa mesela günlük 90 liralık bir işe de bahşişleri katarak ikna olabiliyor. Bu noktada da biz şunu düşünüyoruz. Kafe çalışanları dayanışması düzenli olarak bazı meslek odalarının tarife belirlemesi gibi askeri bir yevmiye belirleyip işçilerin çalışacakları iş yerine bunu referans göstererek ücret anlaşması yapmasını sağlayabilir. Yani normalleşme denilen süreçte de bahşişlerde ciddi bir düşüş yaşanmasının yanı sıra kapasite
in addition to these problems, due to the capacity problems, many workers had some problems, and our colleagues need to work in a healthy and safe environment. And those who are not able to work, we are also creating a solidarity fund for food that our colleagues are in need of. And in some cases, in some days of a week, we work on our colleagues, and we are in solidarity with all these issues. And in order to add all these issues, we pay importance to these issues. And contracting based on protocols are also important. In addition to all type of actions, we are ready to act to convince workplaces to sign contract for a certain period. And if any workplace refuses it, then we can organize something else. And of course, we can also boycott some of places, and it will be a key force, driving force for trade union movement in Turkey as well. And in my last point, the social security premiums should be paid from the workplaces while they are away from workplaces during the COVID-19. And it will be unequal to the trade union struggle because it will support the trade union struggle. We salute all those who are struggling in this period. Of course, we respect health officers, and also we commemorate those who lost their lives while serving to the community under these days. We also would like to thank our panelists who raised the issue of the workers in pubs and also cafes, and for sharing their experiences. Now, I would like to give floor to Aslı Odman. She is a social scientist, and she is our dear colleague who is documenting all these issues in the social movement. Thanks. Can you hear me well? I would like to share my screen. It is part of my discipline, I would like to share my screen.
Şu anda ekranım geliyor mu acaba?
Can you see my screen?
Ekran görüntüsü size ulaşıyor mu?
Can you see the screen? Yes, we can see.
Tamam. Şu anda şu anda da oluyor sanırım, değil mi?
So you can still see the screen, right?
Yani büyük ekran yaptığımda da görebiliyorsunuz slaytlarımı. Sorun yok değil mi? Yani tamam
I think
Tamam.
yes.
Çok teşekkürler.
You can see the screen. Thank you.
Gerçekten çok, yani hep söylenir ama çok heyecanlandım. Hani,
I am excited. Of course, we are excited whenever we attend any symposium, any panel, but this time I'm really excited because I have been listening to various and informative speeches like Federici, Betül, and I will talk about some issues in my 20 minutes, which are common, which have common points with Silvia Federici and also Betül, who just shared her opinions. And then I will give floor to, I will also make some references to France, then our colleagues will talk about this issue. And of course, this sector which has become invisible, which is considered exceptional, which is considered particular, and we have worked on this sector to make it visible. And the title of my presentation is "The Body of a Worker Allows to See the Pattern of Environmental Destruction and Those Who Work Under the Pandemic," the body of the workers under the pandemic, because workers have to work harder than the past, especially for domestic workers. They survive on the basis of daily jobs. They collect the leftovers of people from cans, and body is very important for me, for the ground zero. I'm sure Annie is also is going to talk about this issue, and I'm sure she agrees with me that the body of workers is a symbolic meaning to understand the body of environment. That's what we will talk about, and I will talk about the labor agenda, the red agenda, to make it more visible. And since the 16th century, as Federici stated, the female body was made invisible. So I hope that it will serve as a bridge between all these presentations. And we also heard the issue of data commons 2 days ago, and I will do my best to serve as a bridge in next 20 minutes. Of course, today, while we are trying to act as a bridge, we are all talking about our personal life cycle, which is short comparing to the longer history of the world, and it is 1 year, it is the first year of the anniversary, and we launch our first year report, and you see the figures of the COVID-19, and let me underline one clear fact. These figures demonstrate only the minimum figures, and in this period 861 workers lost their lives while they were working, and they had no other chance than working despite the COVID-19. And these are not the total figures of the workers. And of course, we are working all these issues, and in the past we had 367 workers who lost their lives in the health sector, and these cases were confirmed thanks to the Turkish Medical Association efforts, and it requires qualitative issue. And unless the Turkish Medical Association had worked on this issue, these people could have not been documented. And we have 376, and we have this office workers, and also in the commercial workers, we lost 228 workers. That includes couriers, delivery workers, and also accountant workers. Why we are telling all these issues? Because we do not have data that have been categorized according to their professions. We do not have any map that shows industrial areas, ports, or factories. So there is no data to trace these issues. And now we are collecting this data to trace this issue. And we also have refugees who also form an important aspect of the workforce in Turkey. And since 2011, these workers and women workers are invisible according to the official data. Of course, I can tell more. And as I said, we launched our report on the loss of workers, and those who lost their lives so that they become visible. Who are the leading figures? And we do not have information. For example, agricultural workers, those who work in the seasonal agricultural workers, because there is no formal connection between their professional status and also their death. And it is same for informal workers. And we see their death, and also we see that these people are working sometimes at home. These are domestic workers, and also there is an extra stress for those who have not found a job. And being an active worker, let me underline once again, having a job, being an active worker is a privilege now in Turkey. And we have only two data. We know that those who lost their lives are younger than the majority of the society, as the Turkish Medical Association's report indicated that. Because when we look at the death of workers, we see that, for example, it is 100% those who are between 28 to 27, and it is more than 50% those who are between 28 to 50 years old, and the average of people who lost their lives is lower than the European rate. That means there is an important data to examine in this category. We also see that workers are in essential workers, and under the current value systems, these people are made invaluable. This is why they work in these categories, and this is why and how they lose their lives so easily. And there are these essential workers like commercial activities and also other activities. And this report is from our last year, and it is also a striking figure. What we know that last year, 2,427 workers lost their lives, and these figures exclude any occupational disease. And as you know, occupational diseases do not include COVID-19. And if you multiply these figures, with other categories, namely occupational diseases, then you can reach a higher number. And if we add also women workers, refugees, then the total figure is too high. And what we see that it is the first time that 31% of these deaths is COVID-19, and traffic accidents are the second factor in these occupational deaths, and it is 16%. And also facing different problems is 12%. We have also 68 child workers. My dear colleague Murat Kürek and myself worked on this issue, and we asked the question, and we created an interactive map, and we said, well, since it is invisible, and since we know Istanbul better than other places, there is an application which says life can fit into home, and this is an app which shows the risky areas and which categorizes neighborhoods according to the risk level. And this part shows the eastern part of Istanbul. It is the further east of Istanbul, and here in Turkey, east doesn't mean geography only, it has also a political meaning. And this area is the area of ports and docks, and it is a meaningful area, and I would like to call it meaningful invisibility, because this is the area of docks here where ships are being manufactured. And when we work on this area turns into yellow. What we see that there are areas, since the app which is called Life Can Fit Into Life does not show workplaces, then we can see so many people who live and work together, and their risk of being infected is not included, is not taken into consideration, though they work as 50 people, 100 people, or 200 people at a workplace. And more than 40% of people work together in a crowd area. That is how they work. This is the working conditions, and it is from the Anatolian side. And let's move to the European side. I just would want to show this part, and this is an interactive map which is meaningful for you as medical doctors and those who are working on the ground. You see that this part is Bağcılar, Esenler, Güngören. To me, this area, whenever we check data from this app called Life Can Fit Into Home, my colleague Murat needed to combine all this data, and I call it the area which is highly problematic for workers, and I call it the area of Bermuda Triangle, because these are the area of textile workers. They work together. And we have COVID clusters and COVID areas. And we see, unless COVID-19 and infection are prevented at workplaces, all individual approach to COVID-19 will fail, and there is no way to prevent the pandemic. And this area has been always in red, this area. And you can see this corridor, for example, this Halkalı to İkitelli, which is also area of workplaces. And then if you move to left, then we see that there is a lesser risk of COVID-19, as our dear colleague Arzu Çerkezoğlu stated. So the corridor between İkitelli and Halkalı, then staying home is a privilege, and those who can stay there are in a better situation. There is no examination of their medical background, medical history, or according to race, ethnicity, their gender, or also medical medicine. But we always show it in an opposite side. And we do our best to understand it. So I have 5 more minutes to conclude, and I do not want to take too much of your time. I'm sure it was a hard day for everyone, especially for medical doctors, because medical doctors are working really, really hard in these days. Although we are talking about these problems, medical doctors face more problems, as we have seen in our statistics. So I do not want to take too much of your time. I do not want to take Annie's time as well. So we should look at the essentiality rather than value. So we should look at the reproduction of the planet rather than production for accumulation. So we should look at peculiar values rather than nature, land, human body, mentality, and animal body. And we were saying that in our Assembly for the Occupational Safety, we were saying that we are under state of emergency, although it has not been officially declared, because we see suicide cases at workplaces which were not invisible. So it is like a crime scene. It is like a battlefield for workers. This is why we call it an emergency case. This is what we call it a state of emergency case. Unless we declare it state of emergency situation, which public authorities declare, will not be meaningful for us. We will not be able to see the ecological reasons behind these problems. So essential workers, which the system discuss, which the system classify, and it is important for the reproduction of the society, for the planet. Of course, it is like a very big cluster of stars, and for example, for mining activities that companies use cyanide, or for private university academics, private university administrative staff, we should think about all these concepts. We should revise all these concepts with such a broad spectrum, as Annie will also talk about, this gig economy or Uber concept. And we should think about what to do as a response to all these problems. And there is one more map that I would like to show you. It is occupational risk score. It's an infographic, and it is very important. So as a response to COVID, what are the risks of COVID-19 distribution on the basis of jobs and occupations? And if you earn 30,000 people per year, then the risk for these people is like this. And if you earn less than 50,000, then you see that there has been an increase in risk. and this category includes nurses. This risk includes security officers at hospitals. So there is a oppositional direction between the risk and also the income level. So what we can propose, what we can recommend to overcome these problems. So it's like a woman in the kitchen. What do you need to make a soup? So we need to improve struggle alliances so that we can reach the desired level of struggle against the capitalist system. And there is need for one health mentality to cover workers' health, the mental health, and also public health, and also environmental health. And Federici gave the example of Monsanto. She gave an example about pesticides, and we are working very hard, and it is important to see that these communal activities are still part of this issue. Let me conclude with some demands. What type of demands we have? As Federici also underlined, the reproduction labor should be visible at the decision makers level for the public health system, because health officers are important for everyone. We should make this demand more visible. We should promote this visible. And labor organizations should be based on life, should be based on economy. So labor organizations should pay more attention to life rather than economy-oriented systems. And of course, it includes intellectual labor, intellectual efforts. We are working all these issues, and occupational health and safety should be part of the permanent agenda of the trade union movement. And also labor agenda, which I call it the red agenda, because companies try to make it green, and we should strip this green, and we should make them together. We should work on all these issues. That means the red agenda, the green agenda, and also we should talk about this data commons, and also we should talk about intersections. This is the way to build alliances. We should collect materialist data for everyone, and because the body of workers relies on pesticides, relies on water that is contaminated with pesticides, with other chemicals, and we are under the surveillance of the government. We are working all on these issues, and public health officers who work despite all this pressure deserve appreciations, deserve thanks. And war refugees, for example, are not even considered as workers. And the Turkish Medical Association announces these people as workers, which is very important. And if we are able to talk about all these issues in such a symposium, it is very, very important. And I think it is very important for us to think. And this is my last slide. We should think about the situation in a way that goes beyond the emergency. We should create common points and common interest for data, for knowledge, and we should make horizontal networks common for everyone. We should create and build these common points, and we can maybe ignore some differences because of the current time. Is not the time to think. When we talk about children, we should not think about heterosexual family only. We should think about all types of children who are vulnerable. We should think about animals. We should think about plants. And whenever we organize in a workplace, we should think about everyone. We should think about all parts. And unless we target the worst workers, the workers in the worst situation, we will not be able to convince others, because these people consider themselves in a privileged position, and sometimes they may think that it is something they do from their own pocket. It is like a grace, as our colleagues said. It is time to organize now and here. Thanks for your patience, and apologies for talking too long.
Çok teşekkür ediyoruz. Sevgili Aslı Odman'a.
Thank you very much, Aslı Odman.
Evet, güzel bir köprü kurdu. Şimdi ben çok
She built a nice bridge with France. Now, I would like to give the floor to Anita Tebomuni. Ani is well known in Turkey, actually. I think it was 4 or 5 years ago. In one of the activities of Turkish Medical Association, she was hosted in Turkey, and we had the chance to listen to her. Ani is a French sociologist. She's especially working on health, workers' health and occupational safety, and throughout all her life she has worked on the problems of the working class, precariousness, occupational health issues, asbestosis, occupational cancers, etc. In 1983, she entered INSERM, and in 1992 she was appointed the research department director, and she is still the honorary director of the institution. She's also known for her book, which was also translated into Turkish, which has received award. She has many articles, publications, especially on workers' health, occupational health. So we always benefit from her writings and observations. Welcome once again. I give you the floor, Ani.
First of all, I would like to thank you for this.
Annie, yes? Can you make the screen bigger? We just see the half. On voit juste la moitié de ton écran.
Is it okay?
No.
No.
No, il faut.
I don't understand.
La flèche qui voit la droite.
Attends.
Sur PDF, il faut cliquer sur la flèche à droite qui monte vers la droite. Oui.
It's okay?
Yeah, it's better. It's okay now.
Sorry, I would like to come back. Partager. Why it is not...
Tu vas derrière, première page de PDF, après tu montes. Comme c'est un texte. Tu peux monter jusqu'au début du PDF, après tu montes, tu partages. D'accord?
I will do again. Is it okay?
Yes, it's okay now.
Okay. Thank you very much for giving me the opportunity to share what is the experience for workers of this pandemic. It's not possible to understand the situation without a glance on what happened in the past 40 years about health policies and their consequences in terms of inequities, before coming on our main issues, working conditions and workers' health in the pandemic. First, maybe you had in mind this defiant and rallying cry of WHO in 78, Health for All in the year 2000. Embedded in the Declaration of Alma-Ata, the challenge affirmed health as a human right, promised access to health based on socio-economic development promoted in the new international economic order, sanctioned government provision for universally accessible primary health care, and condemned as unacceptable the existing gross inequality in people's health status. It took just 2 years for the wealthy countries to marshal their opposition, and in 80, the World Bank published its first health sector policy paper, which reduced primary healthcare to a selection of limited strategies. This selective strategies approach marked the abandonment of Alma-Ata primary healthcare principles and the start of privatization. The French health system is built on the basis of a compulsory national health insurance scheme that formally provides health coverage to all legal residents. It combines public financing, health insurance, and private resources, with a public-private mix in the provision of health services. The financing of health insurance is based on employee contributions paid jointly by employers and employees. However, for the last 30 years, successive governments have constantly exempted employers from paying their contributions, renamed social charges, thus producing an indefinitely growing debt. This continuous exemption of employers' contributions has obliged the state and the health insurance system to resort to private borrowing in order to cover at least the incompressible cost of staff, equipment, and operations, and above all, to honor the repayment of the debt owned by companies to the social security system as a whole. Since 1990, the use of financial actors and instruments has transformed the system, the health system, as they have become the main providers of funds for debt refinancing, short-term needs, and capital expenditure. They have also introduced financial language, parameters, and priorities to enable and support funding changes. That means that in the last 20 years, we were facing an estimated debt of 32 billion, and that means a lot of closures and staff cuts, 70,000 public hospital beds have been eliminated and 8 billion in savings have been exposed. And you can imagine the effects on health services. In June 2019, even before the COVID-19 pandemic, a lot of hospital staff came in strike and warning on the critical nature of the situation, with budget cuts bringing the health system to the brink of collapse and putting patients' lives at risk. What was the French government response to the COVID-19 pandemic? In this context, the French government has been overtaken by the events. There were no mass manufacturers in France and no anticipation in the laboratories to start a large-scale testing campaign. The first decision shared by many other countries were to minimize the seriousness of the epidemic and to deny the importance of strategies based on experience with infectious diseases. From the very beginning, the government relied on the individual responsibility of people and not on a coherent organization based on the basic principle of infectious disease control, which is breaking the chains of contaminations. This means first testing and then isolating cases and their contacts. Given the inequalities, it would have been necessary to do requisition of hotels and accommodations and provide quarantine in a collective and gratuitous framework. Instead of basing the campaign against the disease on early detection of mild cases by general practitioners, the government focused its strategy on severe cases and the highly technical resources of public hospitals, which were quickly overwhelmed. Hence came the decision of the first lockdown, and we are now at the third lockdown. Health workers were under huge pressure of urgency and scarce resources, and I would like to look at the cases of carers in long care for elderly. This establishment of accommodation for dependent elderly people in French EHPAD have long faced a lack of resources. The French government underestimated the seriousness of the epidemic inside this establishment. The French and was very late in taking into account the rapid spread of the virus in retirement homes. In addition, EHPADs were considered as not being in the category of care facilities and therefore not a priority for the allocation of protective equipment. In these closed places, the total absence of masks, tests, and guns have appalling consequences from the start of the epidemic. Carers and residents were decimated by COVID-19, and a lot of them died in the first and even in the 2 and 3rd steps of the pandemic. The largest private groups managing EHPAD are that one. I will not comment very much more. Just to say that Korian is the leader one and the most profitable. And during 2020, they had a lot of turnover increase, but they distributed a lot of money to shareholders instead of bettering the health condition and working condition in that kind of home for elderly. And for workers, the situation was really very, very, very stressing, and a lot of them were contaminated and died from COVID. You can read some expression of them, expression in papers, because it was such a scandal that a lot of articles came in the media. And the pressure, the problem of staff shortage, every kind of working conditions were very, very badly managed in that time. And it was a problem not only for physical health, but also for mental health for them. And you know, the President Macron said that carers are heroes because they are heroes in a war against the virus. But it's not a war. We are in pandemics, and we have to take care of the carers. The reference to war also conjures up a viral imagination of male heroism, although this is largely contradicted by facts, and there is no place for sacrifice. There is place for professional. And as you know, and I think it's the same in Turkey, faced with the coronavirus as any pandemic, it's women who are in the front lines. 88% of nurses, 90% of cashier in a supermarket, 82% of primary school teachers. You have women in all that essential work in the pandemic and out of the pandemic, for sure. Not to mention the nursery and daycare staff mobilized to look after the children of all these women mobilized on the front line. And it was something really a leitmotiv in revendication of medical and paramedical staff and their trade unions. They need, and they said, we need support, medical equipment, and to be recognized as professional, not as heroes. There is no question of sacrificing anybody. On the contrary, we need to protect ourselves and to be protected, to take care of all of us so that our skills and abilities can be mobilized in the long term. But in the situation of the pandemic, we saw something is really very present in the working organization a long time ago, which is the double standard. But it was something different because it was some organization for the so-called inactive or unemployed who were confined and in blackout and punished for the slightest exit. And on the other one, double standard, the active children, young people, adults forced to go to school or to work in increasingly deplorable and dangerous sanitary conditions, further away they are from the living and working places of those in power and the ruling class. The consequence is it's a huge human cost. On the graph, you can see that in hospitalized patients in COVID-19 in France, 40% are working age adults. And when you look at one of the territories the most poor in France, the excess of mortality in people aged under 65 was the highest in France. And this situation is in relation with the population of Seine-Saint-Denis. The active population is workers in construction, trade, transports, service, and it's the leading territory in terms of population of foreign origins. And they also accumulate health inequalities in every kind of health problems, a lot of them in relation with work and conditions of work. Another EV consequence of the management of the pandemic was what the authorities call non-urgent care deprogramming, and which we can consider as non-assistance to persons in danger. For example, about 100,000 cases of cancer could not be diagnosed within a reasonable period of time in 2020, which is a terrible loss of life expectancy for patients. And you know, in France, a working class a worker is 10 times more likely to die of cancer than a senior executive. There is a huge inequality in cancer. We had also a disastrous vaccination strategy. It was the priority for the government, but at the same time, the situation of the health system did that it was really very badly organized, and the main pharmaceutical company, French Sanofi, has failed in its attempts to create a vaccine. And why? Because for 10 years, the group's strategies has been to drastically reduce the firm's research sector in order to increase the profits distributed to shareholders. So we are dependent on vaccine imported by the European Union with a lot of problems. So one thing again is the priority in vaccination should have been on essential workers, and they will be the last to receive vaccine. And at the end, I would like to say how it was possible to do other strategies, and in the fight against any infectious disease epidemic, the only effective strategies are those that allow the organization of clinical, psychological, and social follow-up of the sick people and their contacts, with the aim of accompanying, caring them, and interrupting the chains of contamination. It's not the ill persons who need to be in lockdown, but the sick ones, and those they may have contaminated. At the initiative of our association, Henri Pézerat Association, a coalition of trade unions and associated association published an appeal that set out priority issues for action. Let us mobilize for funds allocated to the communities, to the association, to all the actors, to trade union, to all the actors of social life, in order to organize not a vertical screening program, but the recreation of local structures which will be able in a human and gratuitous way to take care of the patients, whatever the pathology or pathologies, but also all those left behind by this crisis. The avoidable deaths from COVID should not lead us to forget the avoidable deaths from asbestos and other carcinogen, mutagenic, neurotoxic, reprotoxic substances, nor the suicides and burns out, so preventable, due to a deadly work organization. Let's not wait for the vaccine to act now, to demand the means and to organize solidarity in the fight for health, dignity, and life. Thank you very much.
Teşekkür ediyoruz. Önceki oturumdan aslında başlayarak ardından da bu oturumdaki birbirini tamamlayan ve birbirine köprü kuran 3 coşkulu konuşma gerçekten çok birbirini tamamladı ve tabloyu ortaya koyması açısından da son derece önemli.
We have listened 3 presentations. Annie presented the situation in France, which is very important, and in fact, all the governments have similar practices and policies on COVID-19 because the situation in Turkey can be compared to the situation in France because throughout the COVID-19 period, the government of Turkey provided social benefits to its citizens, but the amount is the lowest amount in all over the world, together with Mexico. And we have certain problems in the management of COVID-19, and our situation is quite problematic, and in total, it is $168 billion, but Turkey spent only $7.8 billion, and throughout the pandemic, the government of Turkey provided benefits to its citizens, and only 1.1% of its GDP. And according to our reports, it is 7.7% of GDP in France, and it shows all forms of inequalities because, for example, access to vaccines is facing inequalities according to the country's economic situation, and we are facing all these issues, and this pandemic showed all the inequalities. In this session, we will get some questions from audience, and then we had a connection problem with WhatsApp, so we will check the situation if there is any question. Because of the technical problem with WhatsApp, we didn't receive any questions so far. If not, you will have second round for your concluding remarks. So it seems there is no question now. So if it it sounds okay to you, we can have the second round speech to get your concluding remarks for this pandemic, and it may go beyond the pandemic issue. Yes. The first panelist will be Betül Kaya. We will follow the same order of panelists. I would like to thank everyone, all panelists, all audience, and all the organizers of the symposium. In addition to what I have said already, we will continue to revise our position and adapt our struggle according to the circumstances that are emerging under the COVID-19. And thanks for providing this chance to me. Yes, Aslı? You had some problems with timing in your presentation, so you can use a few more minutes. I think I covered almost everything. I can expand my points, but Annie's presentation indicates one important point, which is the social expenditures of the government have almost similar practices, because although expenditures are collective, risks are considered individual, which individuals cannot bear, which individuals cannot overcome such risks. And in this respect, we should join the struggle so as to object to individualization of risks. And we should also stand by our colleagues, by our friends and our citizens. Because in workplaces, as I said, hundreds of people work in one place. And when governments say you are responsible for your own health, then it is not possible to overcome such risks. And people think about their own mistakes. People question themselves to find what caused this health problem. And we are in a position to check what we have done. Rather than feeling this responsibility in our individual space, we should organize more so that we can respond to our employers, to the public authorities, to managers, to the government, to the rulers, that it is not an individual responsibility, but a collective responsibility that the governments have. And we should also think about circumstances that led to the COVID-19. As our dear colleague Betül said, we will not pay the price for this outbreak, because we are also being drawn to the individualization, because to some extent being individual is attractive, is particular, and we should not tempt to this attraction, and we should show the collective responsibility in this respect. We should remind governments of their obligations in this respect. In this sense, the COVID-19 served as an academy. And we were talking about, for example, individualization in academy. We were talking about elitist approach within universities. For example, when you ask people to wear masks, it is not working any longer. We lost the momentum. What I can say is there is need for a collective response to this collective problem, because we must stand against this problem on a collective basis. And I would like to thank everyone, especially the Turkish Medical Association, which makes it possible for our country. I would like to thank all panelists, Annie, Betül, etc. Thank you, Aslı. There is one more question, but you already responded to the question. You already answered to the question, because the question is about, is another strategy possible? And he said, yes, another strategy is possible. And the question is about how to form different platforms, but you already answered that question. So I would like to ask this question to Annie. Is a new strategy possible? Is there a way to build new platforms? Yes, the floor is yours.
Yes, another strategy is possible, and I think it's not only a strategy, is the importance of counterpowers. That means the action of trade unions, the resistance, the associations, academics who are very involved in criticism of the situation, but also a lot of proposition. And even if it's very, very difficult at the moment, because we are in a period with some kind of very authoritarian position of the government, even like that. For example, in medical staff and nurse, and you have a lot of resistance strategies who are organizing people, even if it's difficult at the moment. There was some strike, some demonstration, even during the pandemic. And now in France, we have a huge movement in the culture, theater, music, artists who are at the moment occupying theaters in a lot of countries. That means that there is, from the society by itself, a lot of resistance. And even if with lockdown, we are again in lockdown, even like that, we have the hope, because of every possibility for collective organization at the root level, not at a large level. You know, we are celebrating La Commune, which was a revolution in France, and it was very, very important, 150 years earlier. And for us, it's a very important moment of the French history. And I think there is this certitude, this conviction of the possibility to organize resistance in another way, for sure, but with the same important issues, which are health, life, equities, justice, and dignities. Thank you.
Evet, bir kez daha teşekkür ediyorum.
Thanks again.
Oturumuzu kapatırken birkaç şey söylemek istiyorum.
I also would like to share a few points from my side as part of the concluding remarks. All the panelists indicated that this COVID-19 has demonstrated once again and in a clear way that 40 years there are policies and practices that ignore human nature, labor, and pays more attention to neoliberal policies to make profit. And this system has collapsed, and COVID-19 made it clear once again. As Annie stated, there is need for another strategy, which is possible, and there is need for another politics which is possible, which should be based on labor. And there is need for a new social order. In this respect, there are possibilities of struggle, there are possibilities of resisting, and we have more opportunities than the past. In this regard, we will continue to struggle shoulder by shoulder. We will continue to struggle together. In this symposium, we covered many different topics, and I would like to thank the Turkish Medical Association for organizing this symposium. I would like to thank all panelists, namely Betül, Aslı, and Ani, and also I would like to thank audience for their time tonight. Thank you.
Dediler ki hayat güzel, eğri doğruyu bilenler. Dediler ki umut sürer, insanları seversen eğer. Dediler ki hayat kısa, eğer mutluluklar olmasa. Dediler ki kalmaz yanına yaptıkların bu dünyada. İyiler kazanır, kötülükler kazanır dediler. Mutlu olmak için mutlu etmek yeter dediler. İyiler kazanır, kötülükler kazanır dediler. Mutlu olmak için mutlu etmek yeter dediler.